Hello everyone, greetings of the day, and I welcome you to another part of Nutraceuticals where we will understand the mechanism of action, the bioavailability of these nutraceuticals when they are given in complete herb form or when they are formulated, and the role of some of these nutraceuticals in major diseases. Is there a need to understand the mechanism of action of these nutraceuticals? Yes. For nutraceuticals to be better accepted in the market today, it is necessary that we understand how these nutraceuticals act when delivered or when taken. So, the most important thing is it gives a scientific validation. Without knowing how they work, nutraceuticals remain just as traditional claims. So, when we take a lead from the tradition and give it as a nutraceutical, it is very important that we have some scientific proof and data to prove this claim. So, mechanistic studies provide evidence based justification for their use. For example, curcumin, which is India's age old traditional medicine or herb which is used for a variety of diseases, and the scientific proof generated for this proves that curcumin's NF-kappa B inhibition explains its anti-inflammatory role and also very important in prevention and treatment of cancer. Better disease prevention and treatment when these mechanism of actions are understood by identifying which pathways are affected when these nutraceuticals are taken, and they can be matched to specific diseases. For example, omega-3 fatty acids, they reduce triglycerides and inflammation and are useful in cardiovascular health. Personalized nutrition and nutrigenomics can be achieved by understanding the mechanism of action, and today it is very well proved that whatever we take, the food and diet which we take determines our genetic makeup. This study today is known as nutrigenomics. Mechanisms, understanding them help us understand how these genes and diet interact. This supports personalized nutraceuticals for people based on genetics, lifestyles or disease risk. There is also an improved formulation and bioavailability. When we know how a nutraceutical acts, we can design better delivery system using modern day techniques like the nanoparticles, liposomes, synergistic combinations, etc. For example, piperine increases the bioavailability of curcumin by inhibiting its metabolism, and by improving this, it has been proved that the bioavailability and absorption of curcumin has been improved at least 2000 times. The safety and dose optimization can be achieved with a better understanding of the mechanism of action, and these mechanistic insights reveal the possible side effects, interactions and safe dosages. Hence, we can expect a comparatively safer dosage form. Isoflavones which act on estrogen receptors are useful in menopause, but may not be considered very safe in hormone sensitive cancers. Innovation and drug discovery can be achieved by understanding the mechanisms. Nutraceutical mechanisms often inspire and have shown that they lead to new drug discovery. For example, statins, which are cholesterol lowering drugs, were developed after studying how the red yeast rice compounds inhibit HMG-CoA reductase. The most important is the regulatory approval and market credibility by understanding the mechanism of action, where these clear mechanisms helps a nutraceutical to gain broader global acceptance as functional food or therapeutic adjuncts. It builds the customer trust and helps in clinical trials. Hence, understanding the mechanism of action allows us to use nutraceuticals rationally, effectively and safely, moving them from traditional remedies to scientifically backed wellness and therapeutic effects. So, the therapeutic effects, when understood at the molecular and cellular level, is very easy to convert them into a dosage form, and these remain or become the key factor when we are converting a nutraceutical into a new drug delivery system. For example, many nutraceuticals like the polyphenols and flavonoids neutralize free radicals, reducing the oxidative stress, and this becomes the key factor in aging, in cancer and cardiovascular diseases. And many of these nutraceuticals, by understanding this mechanism, can be targeted for these. The antioxidant action, which neutralizes the free radicals, it hence protects the DNA and proteins and many lipids, and this is useful as anti-inflammatory. It helps in gene expression modulation, it helps in some enzyme activity regulations and also in some improving of cell signaling. Once these nutraceuticals are absorbed, only their metabolically active forms show effect. Hence, it is very important to understand how these nutraceuticals are bioavailable once taken in. The influencing factors are the solubility of the main active constituent from the nutraceutical, the gut absorption of these actives, metabolism and excretion. For example, the poor bioavailability limits the clinical use of curcumin, which has been modified today by using different methods, like the formulation strategies like converting it into a nano emulsion, liposomes or micelles. So, these are some of the modern day formulation which increases the bioavailability and hence the efficacy. Bioavailability determines how effectively a nutraceutical reaches systemic circulation and exerts its effect, and there is an improvement in solubility. Many bioactives like the curcumin, which are poorly water soluble and are limiting the absorption, is improved when it is formed as a nanoemulsion or a liposome. Different dosage forms determine the bioavailability of a nutraceutical, and hence these nutraceuticals, by formulating in different dosage forms, can be compared for their bioavailability. Capsules and tablets give us precise dosing, but there is slower absorption. Soft gels and liquids, there is better solubility and absorption. Gummies, which are commonly used today, are patient friendly, greatly complied, but the sugar content management is difficult and hence the limitation for use with diabetic patients. Functional foods like fortified milk, probiotic yogurt have the dual benefit of nutrition plus therapy, and there are some novel systems like sprays, transdermal patches and nano delivery systems. So, when we compare, this table tells us what are the pros and cons of these different delivery systems. Tablets and capsules, the most common form available, may have slow release and hence slow bioavailability. These are gummies which are more acceptable because they are more palatable and good with children, but often contain high sugar content. So, depending on the nutraceutical and the disease which we are going to target, we can choose a different kind of delivery systems looking at the pros and cons. When we design a nutraceutical, it is very important to look at the mechanism of action of different herbs present in the nutraceutical, and hence the synergistic effects of a nutraceutical combination becomes very economical and of high therapeutic value. For example, multi-targeted health benefits when combined, like the skin health and cardiovascular support. Example, there are a lot of collagen peptides plus omega-3 fatty acids and vitamin C. This nutraceutical can be used for good skin health and cardiovascular support. For cognitive and metabolic health, curcumin can be combined with resveratrol and with a probiotic, and an excellent antioxidant synergy can be obtained with vitamin C regenerates and with vitamin E. So, here the benefits of combining this synergistic nutraceuticals is lower doses are required, enhanced efficacy via multiple pathways and broader disease prevention spectrum. These synergetic effects can be for multi-targeted benefits, and combining nutraceuticals can amplify their effects across multiple domains. So, the skin and cardiovascular example which we just saw, the diabetes and cancer, curcumin and resveratrol modulate insulin sensitivity and inhibit the tumor growth. For hair and oral hygiene, biotin supports hair growth, green tea catechins reduce oral bacteria and inflammation. So, such nutraceuticals can be targeted for hair as well as oral hygiene. The formulation synergy, where products combining collagen, hyaluronic acid and antioxidants are targeted for skin aging and multiple angles. Different mechanism of action is very important to be understood. So, the antioxidant mechanism is where it prevents the oxidative stress and it neutralizes the free radical. This is a very important mechanism of action. Majority of the nutraceuticals comply with this antioxidant mechanism. Anti-inflammatory pathways, there are so many anti-inflammatory pathways which a nutraceutical can comply, and the mechanism of action may be by inhibiting the NF-kappa B pathway, by reducing the COX-2 and LOX enzyme, and curcumin is one such nutraceutical which complies with so many different kind of mechanism of actions. Modulation of gut microbiota is an important mechanism to be understood with different kind of nutraceuticals today, and since there is enough scientific data which shows us that diseases arise from the gut, the modulation of gut microbiota and maintaining the good bacteria in the gut becomes very important today. Prebiotics, there are soluble and insoluble fibers which stimulate growth of good bacteria. Inulin is one example. Probiotics like the lactobacillus which maintain the gut flora and hence helps in improving immunity. Gut bacteria produces short chain fatty acids which regulates metabolism, inflammation, brain gut axis is protected. The gene expression and epigenetic modulation can be achieved with a nutraceutical which can turn genes on and off. This is called nutrigenomics. So, this depends on what kind of diet the body receives, and the mechanisms involved in this is histone modification, DNA methylation, miRNA regulation. Through this, the genetic makeup can be modified and it can be decided. Examples of such nutraceuticals are omega-3 fatty acid and lot of polyphenols. The enzyme modulation, where some of these nutraceuticals act as enzyme inhibitors or enzyme activators. For example, the isoflavones from soy inhibit tyrosine kinase, which is useful for cancer prevention. The garlic, which contains allicin, inhibits HMG CoA reductase, which helps in reducing cholesterol. Cell signaling and receptor interaction, where nutraceuticals mimic or block signaling molecules. For example, the phytoestrogens again from soy, they bind to estrogen receptors which are beneficial in post-menopausal health. Omega-3 fatty acids from different kinds of seeds and nuts affect GPCRs, which reduces inflammation. Immune modulation is another important mechanism of action seen with many nutraceuticals, and the beta glucans from oats or mushrooms are known to activate macrophages and the NK cells, where they increase the immunity and fight the foreign cells or infection. Vitamin D is also known to regulate the T cell function. Detoxification and hormone regulation, this is a mechanism of action seen with herbs or nutraceuticals like broccoli, which induces glutathione S transferase. It detoxifies carcinogens. Isoflavones regulate estrogen metabolism. Nutraceuticals act at multiple biological levels and hence they are known for their holistic healing. At the molecular level, it targets the genes, enzymes and signaling pathways. At the cellular level, it prevents the oxidative stress and hence can be used as anti-inflammatory and for inducing apoptosis. This is useful for cancer prevention, for systemic action to prevent the gut microbiota, to improve the immune system and maintain the hormone balance. Looking at some of the diseases of how these nutraceuticals act, nutraceuticals target cancer through a multiple pathways. For example, genistein from soy, it acts as a phytoestrogen with anti-estrogenic effect. So, this can be used for hormone related cancer. It inhibits angiogenesis, formation of blood vessels. So, these blood vessels which feed the tumor, if the supply is cut then the tumor dies. So, it inhibits formation of new blood vessels. Promotes apoptosis, this is programmed cell death by activating caspase 3 and caspase 9 enzymes. It blocks the NF kappa B signaling where it starves the cancer cell for energy and hence leads to death. The sulforaphane from broccoli and kale also induces phase 2 detoxification enzymes and is used as an important nutraceutical in targeting cancer. It modulates antioxidant gene expression, reduces DNA damage and inhibits tumor initiation. Curcumin from turmeric suppresses proliferation of cancer cells, inhibits COX-2 and NF kappa B pathways, prevents inflammation, promotes apoptosis and blocks angiogenesis. So, we can see here there are more than one pathways and more than one mechanism of action where these nutraceuticals act in synergy for different diseases. For diabetes, we have been hearing of many traditional herbs which are used as nutraceuticals to treat diabetes. They help regulate blood glucose and improve the insulin sensitivity. For example, alpha lipoic acid which enhances the glucose uptake in muscle cells, it reduces oxidative stress, prevents the cells which produce insulin and hence improves insulin sensitivity. Fenugreek, which is methi, Trigonella phinum grassum, it contains 4-hydroxyleucine which stimulates insulin secretion. It slows carbohydrate absorption via the fiber content which is present in form of mucilage. Cinnamon extract which mimics insulin action by activating insulin receptor kinases and it inhibits the phosphatase activity, thus enhancing insulin signaling. Resveratrol from grapes activates AMPK and other pathways which improves the mitochondrial function and insulin sensitivity and hence useful in diabetes. There are a lot of nutraceuticals with sufficient scientific data which have been used for prevention, wellness and treatment of different cardiovascular diseases. Nutraceuticals support the heart health by modulating lipid profiles, maintaining the blood pressure and controlling the inflammation. Omega-3 fatty acids again are helpful in reducing triglycerides and managing the blood pressure. They inhibit the platelet aggression and inflammation via eicosanoid modulation. The CoQ10, coenzyme Q10, which improves mitochondrial energy production, reduces oxidative damage in cardiac tissue. This was repurposed for cardiovascular health. Garlic inhibits HMG-CoA reductase, thus lowering cholesterol and improving the cardiovascular health. It enhances nitric oxide production, improving the vascular tone. Flavonoids from berries, tea and cocoa improve the endothelial function. They reduce the LDL oxidation and inhibits platelet aggregation. LDL is the low density lipoproteins. Factors affecting bioavailability of nutraceuticals: the physicochemical properties of compounds like the solubility of curcumin, stability of some of the nutraceuticals like the catechins in green tea, the molecular size and polarity. This should be considered when we are formulating or designing a nutraceutical, because making it into a dosage form or a delivery form without considering the bioavailability concept may lead to a poorly absorbed nutraceutical. The standard powder or capsule, when considered, should be compared with advanced carriers. Use of nanoparticles, liposomes, micelles, nanoemulsions and phospholipid complexes can dramatically improve the absorption. And digestive and metabolic barriers should be considered for a nutraceutical before considering converting it into a modern day dosage form. Interaction with other nutrients are very important, which determine the bioavailability, and the herb or the herb drug interactions must be considered when we are planning a polyherbal nutraceutical formulation. Some of the nutrients enhance absorption. For example, vitamin C added, it increases an iron absorption. Piperine enhances curcumin bioavailability, but others inhibit the absorption. For example, calcium can reduce the zinc uptake. And the host related factors should be considered like the age, health status, gut microbiome and the genetic variation in metabolism. Some of the strategies which are used here to improve the bioavailability can be use of nano formulations, where the nutraceutical is converted into a nano form. This improves bioavailability and hence better therapeutics can be expected. Lipid based delivery, where self emulsifying drug delivery systems are used. Co-administration with enhancers. Piperine is one of the actives which when added to different herbs has shown increase in bioavailability. Encapsulation techniques as liposomes, cyclodextrins, hydrogels for protection and controlled release, and a probiotic modulation using gut microbiota to enhance the biotransformation and uptake. Hence, concluding, nutraceuticals have emerged as a very powerful bridge between nutrition and pharmacology, offering preventive and therapeutic benefits across a spectrum of chronic conditions. They are mechanism of actions, some of them which we just saw in major diseases range from antioxidant and anti-inflammatory effect to gene modulation, enzyme inhibition and to receptor binding. They demonstrate their potential to influence disease pathways at molecular and cellular level. Whether targeting cancer, diabetes, cardiovascular disease, these bioactive compounds provide multi-targeted interventions that complement conventional therapies. However, the effectiveness hinges on the bioavailability, which remains as a major challenge while designing a nutraceutical, and this is because of the poor solubility and absorption, and we must consider advances in formulation science and choose the right delivery system. The synergistic use of nutraceuticals combining ingredients for skin, hair, oral hygiene and systemic health reflects a holistic approach to wellness, and this integrative strategy aligns with the growing consumer demand for personalized preventive healthcare solutions. As research deepens and regulatory framework evolve, nutraceuticals are poised to become central players in global health strategies, offering scalable, sustainable and science-backed alternatives for disease prevention and wellness optimization. These are some of the references. Thank you.